State of Affairs is honored to welcome our good friend, Assemblywoman Shavonda Sumter, a Democrat representing what area of the state?
35th District, Paterson, Northern New Jersey.
And in fact, have a title in leadership of the Democratic Party, which is?
Majority Conference Leader of the New Jersey General Assembly.
You've dedicated much of your life, not just in the legislature, but as a leader at a major healthcare system. You are, in fact, Vice President at Hackensack UMC, Mountainside Hospital. Much of your focus is on infant mortality rates,
yes,
particularly in the Black community. 5 times higher than whites?
5 times higher, one of the highest in the country, just in New Jersey alone. And
because?
Because I will say this, our health commissioner has taken a concerted effort, and our First Lady,
Dr. Elna Hall.
Dr. Elna Hall, First Lady Tammy Murphy,
that's right,
has really taken this under their belt. Since the 90s, we've been in the high ranks of infant immortality for African-American women, 5 times higher. It shouldn't happen. A mother shouldn't have to worry about losing her life and the life of her child upon birth, low birth rates. And we have a sundry of issues that really fall into that. And not only as a healthcare professional, but as a majority conference leader, as a vice chair of the Legislative Black Caucus, we really focused on this initiative.
By the way, folks, we'll put up our website right now for an initiative we've been working on for about a year now. It's called Right from the Start NJ, focusing on infants and toddlers and those who care for them. Assemblywoman, what does the state need to do more to help protect infants and toddlers and those who care for them?
Oh, Steve, thank you for asking that question. We need to put money with this, so I am pleased that in the governor's proposed budget, $1 million will be dedicated to doulas. We're talking about a relationship with healthcare professionals for this community.
Excuse me for interrupting.
Sure.
Explain who and what doulas are.
So doulas are birthing coaches for women who may not have a birthing coach or may not know the questions to ask of their professionals and how to talk to professionals who are caring for them during that sensitive time when they're pregnant. What questions to ask their healthcare professional. There's something that we learned, which is implicit bias. As much as we teach cultural sensitivity in the healthcare setting, in fact, we do annual trainings, there's still a language gap where African-American mothers are not being heard, whether they're professionals, whether they're in poverty or low-wage earners. We need to make sure that their voices are clear when they're in the sensitive birthing time, and that healthcare professionals do not ignore all the complications and questions that they have. So doulas will help support them through that in a healthy lifestyle to carry to full term.
There's a bias involved in there, Assemblywoman?
There is.
Explain that to us. Give us an example of what that looks like.
There's an absolute bias and absolute racism connected with an African-American mother giving birth. There is a blind spot to the stigmas and traumas that they may face leading up into the birthing cycle, poverty, low wage earning, child care for children who may be at home, access to transportation just to get to appointments.
Social determinants of health.
Social determinants of health, classic examples. And for decades at this point, we've ignored those factors, which has led to us having the highest rates of infant and mother immortality in the state of New Jersey, in all of the states, in our entire country. We're number 48. And I'm embarrassed.
Out of 50 states?
Out of 50 states. I'm embarrassed that we're number 48. And we can actually do something to change this.